Hello, Uganda. Boy, it's a real pleasure for me to be here. I'm just sorry that I can't be there with you in person. We've done these symposiums for a while now, and because we can't travel due to country restrictions, at least we're able to be with you and to share some education. So, thank you all for being there. Thank you to all my presenters for being here as well. So, with that being the case, I'd like to get started on this. So, I need to thank our sponsors because it's without these organizations that we cannot um, put on these kind of symposiums. I need to thank the Academy of Prosthodontics Foundation. They've always supported us in our endeavors coming over to Uganda. I also want to thank the APS Foundation. This is the foundation of the American Prosthodontic Society. And many of your speakers are members of this particular foundation. And once again, they have supported us in this endeavor. In Toronto here, we have the PACE Center. This is the Prosthodontic Associates Center for Excellence. It is, in fact, our education center. And the proceeds from our educational endeavors here in Toronto go to support our foundation, which in turn supports the work that we do in Uganda. Our foundation is called the Build Your Smile Foundation. Many of you may have heard of this. I am the CEO of the foundation, and there are a lot of other things that I do. If there's ever a time that you need to reach me, you can find me at my first name at buildyoursmile.org, or you can track me down through the internet. It's not that difficult. So what does our foundation do? Well, our foundation is a registered Canadian charity with outreach that started back in 2014 with other groups. We established independently in 2018, and our domestic and international initiatives are in place, which include our local Phoenix Smiles, our Build Your Smile Dental Foundation dental offices, of course, our Ugandan outreach, which is our flagship. We have a series of academic grants and awards that are both local and international. We also put on these dental symposia, and we have locations not just in Uganda, obviously, but in other places as well. Our local programs include treatment for men and women shelters, Holocaust patients, Indigenous women, and other social service groups. So there are a lot of things that we actually do. You can check the website at buildyoursmile.org to get a better idea of what we do. And this just shows one of the pictures of us working in one of the villages that we visit. And these are just some of the other groups that we work with here in Canada. The organization itself has people running it. You cannot run a large organization without the support of your colleagues. And you'll see my picture here, but you'll also see several speakers. You see Dr. Rosopoulos, you see Dr. Bahrami, Dr. Beiruz, Dr. Vera. You also see Mariela Gonzalez, and all these people work for the foundation on a volunteer basis. None of us get paid to do what we do, and that's what I think everyone needs to understand. It is a voluntary organization. And very important to our voluntary organization is the education that we supply. The education is provided on the ground in a clinical fashion. as well as after our clinics close in Uganda, we would originally hold these small group education situations. Now, these are tough to do because we're pretty tired at the end of the day. So we decided to hold these symposiums instead because we can get more information across. Now, it isn't only us that educate you, it's also you that educate us. And I've learned a lot of things from the different people that we happen to work with. Now, together with education on the symposium level, we also have academic grants that we've been providing to students who want to become dental officers, and they're trained in Uganda. And this just shows 3 of the students that are currently being supported. Our symposiums started in 2018. We then went ahead and we did another symposium in 2019 and 2020, and now we are into 2021, and this is our first virtual symposium. So once again, I welcome everyone. Locally, we do have awards, and this award was given to Natalie for demonstrating her promise with global perspectives in oral health. So once again, we do a lot of different forms of work. So the speakers for today. Well, first myself, I'm giving this introduction as well as a short prosthodontic presentation. Then there's Dr. Jeffrey. Dr. Jeffrey is the director of Kihefo, and you will hear more from him. We've been working with him since 2014. There's also Dr. Bira, who's an oral maxillofacial surgeon, positioned in Uganda. There's Dr. Rosopoulos, who's a prosthodontist, and Dr. Rosopoulos is from California, although when you hear his talk, you will notice that he also talks a lot about his homeland, which is Greece. There's Dr. Beiruz, who's a prosthodontist, works with us at PA. There's Dr. Amir Azarpazou, who's an endodontist, also works with us at PA, but is also a professor at the University of Toronto. There's Effie Habsha. Dr. Habsha is a prosthodontist, has been working with me for over 22 years. She's very active. She has visited Uganda with us. There is Rifa McDoom, who's our restorative hygienist, who's also been with us in Uganda several times. There's Dr. Schwartzed, who's a prosthodontist and a periodontist. He works with us as well as at the university, where he heads up the prosthodontic graduate program. And you may recognize him. He's also been to Uganda several times. There's Dr. Chetna Mistry, who's a general dentist here in the Toronto area and has been to Uganda several times with us. There's Dr. Carolina Vera, who is stationed in North Carolina in the United States, and she heads up our Latin American division. There's Dr. Parvaneh Bahrami, who's a periodontist, and she's been with us to Uganda several times. Dr. Carlo Ercoli, who's a periodontist and a prosthodontist, head of the Department of Prosthodontics in Rochester, New York. He's been with us to Uganda. There's Mariela Gonzalez, who's our Chief Financial Officer, who's been with us as well on our outreach trips. And then there's Cheryl Ferrer, who's our lead dental assistant here in Toronto, and she's been with us multiple times to Uganda. So these are your speakers for the day. There are a lot of speakers. You will hear after me from Dr. Jeffrey Anguyo, who will tell you more about Kihefo, and really this man is quite an incredible person. What we couldn't do is put on this whole symposium without the support of this guy. This is Innocent. Innocent is a dental officer. He lives in Kabale. He is the in-country coordinator for the Build Your Smile Dental Foundation in Uganda, and he has put on this symposium every time that we've done it, and he really is one of the lead persons. And without him and his team from Chihefo, it would be impossible to do what it is that we're doing. So these just show some pictures of some of the clinics that we've held when we've come to Uganda. And the clinics really do run well. They're a combined dental medical clinic. And the dental really runs off of these wooden tables where we provide all kinds of dental services. And I invite anyone who wants to come and join us on some of these outreach programs to be in touch with Innocent. And Innocent will tell you more about these programs and how to get involved. And they just show some of the earlier pictures of us here making some dentures for our patients. The lineups can be quite long. People do wait quite a while to get to see us, but we do our best to see everyone. And it really is a pleasure for us to be with you in Uganda. Again, we can't be with you right now just because of the current pandemic situation, but our plans are to come back, I hope, in January of 2022 with a large team and pick up where we left off. So in the meantime, welcome to the symposium, and I do hope that you enjoy your day. Some housekeeping rules, and I'm sure Innocent will fill you in on this. We need to stay on time. We're doing our best to have the speakers join in for question and answer periods around the time that their presentations are being given. And in order to make this run, we have to stay on time. We will start on time and we will end on time. So with that being said, I'd like to throw a little bit of prosthodontics into the mix. I am a prosthodontist. I've been a prosthodontist for over 30 years. And one of the questions that I often get asked, and one of the questions that I ask myself, really happens to be, if I'm going to restore someone's mouth, which is what I do, if I'm going to rebuild their teeth, which is what I do, what materials do I use to do this? Because there are lots of materials that you can choose from. And if you look here at these two pictures, you'll notice that on one picture, this is how the patient came in to see us. And at first glance, this doesn't look too bad. And at the point when the patient came in, we didn't really do very much for the patient. We just observed, we measured, but at a certain point, we had to go ahead and start doing some treatment. And for this particular patient, treatment involved crowning the posterior teeth. You'll also notice that there is a lingual arch wire anteriorly to help hold the teeth in place. And you'll notice that I'm using different materials here to crown teeth. And what I'd like to do is just give you some guidelines on what materials to use if you are going to restore someone's teeth using a crown modality. I know there are dental labs in Uganda. I know there are Ugandan dentists and dental officers who do crowns. In fact, on one of our missions, we also did a crown because we had to. So it's important to know what material to use with these particular restorations. So how do I choose a material for a ceramic crown? How do I do that? Well, I have to ask myself what's going to be aesthetic and what's going to be strong. And I think that's really the key. What is going to be aesthetic is going to be some form of ceramic material. I know that there are composite materials that can be used to make crowns, but we don't generally use them because they're a little bit too weak. So we do use ceramic-based materials. Now, for the anterior teeth, we'll either use a lithium disilicate or something called a lithium silicate zirconia. Now, these materials, especially the lithium disilicate, are especially aesthetic. We use them on the anterior teeth. We also use them on the premolars. But you notice there are two different materials that I've suggested. I've suggested the disilicate and the lithium silicate zirconia. This second material is a lot stronger. It's extremely aesthetic and is a little bit newer to the market, but we do use it. I use it in the anterior region and in the premolar region. Now, when we get to the molars, we have to start saying to ourselves, the forces back here are very heavy. And because the forces are very heavy, we need to use a stronger material. The stronger materials include zirconia or full metal restorations, and I showed you a picture of that. Now, the question often comes up, do we use PFMs, porcelain fused to metal crowns? And we do. They're very good restorations. They're very viable. However, the porcelain on top of them is the weakest of the porcelains. So we don't use this that often. But if we find that it's hard to create a good margin for our ceramic restorations, then we will move back to a PFM restoration. And these just show some examples of some of these restorations in the mouth. I like looking at an X-ray. And I like looking at the X-ray because on some of these ceramics, but not all of them, on some of them you can actually see through the ceramic to see what is happening to the teeth underneath it. Now you'll notice here on the X-ray, the lower premolars have a certain radio opacity. That radio opacity suggests that these materials here are in fact lithium disilicates. If you then look at the radio opacity of the tooth above this, or on the molar here, the first molar, you notice the radio opacity of the restoration is a little bit different. It's blocking the light a little bit more. And with that being the case, we realize this is not really the same material as the one below. And this, in fact, may be a lithium silicate zirconia. But notice that you can see through these. And in seeing through these, you can see how well these things actually fit. And then below it, this large white-looking crown is, in fact, going to be either a zirconia or a full gold crown, and you cannot see through either of these materials. These are wonderful, strong materials, but because you can't see through them, you can't always maintain them very well. So again, looking at the same concepts, we do use different materials in different situations. And what is shown here is we are using lithium silicate zirconia on an implant restoration as well as a crown restoration on the tooth directly next to it. What's interesting about these restorations is they are extremely aesthetic, and they also have what's called a chameleon effect, which means that they pick up color from the neighboring teeth. So again, understand that there are different materials that can be used for these different situations. Here we have zirconia-based crowns in the back of the mouth. You notice we cannot see through them. And the zirconia was chosen for this patient by her dentist because of the strength that they were looking for. So there has to be a justification for why you're choosing a material. If it's strength, okay, go to something strong. But not all people have very high bite strengths. So sometimes you don't need the strongest material. So you have to assess that. But notice the middle X-ray and notice how these upper front teeth, which are in fact not zirconia now, these happen to be lithium disilicates. You notice them, you can see through. And you notice because you can see through them, you can also see the margins of these crowns. And you can evaluate how well these margins fit. And that's important. For me as a specialist, that is really important. And in these particular pictures, you'll notice again different restorations. So if you want to look here at the picture on the upper left, you have an implant that has a PFM with porcelain on top of it. That's feldspathic porcelain. The tooth behind it also is a PFM. The tooth in front of that is a lithium silicate zirconia. You can see through it, but it has a little bit more opacity than the lateral incisor way up at the front, which is a lithium disilicate. You notice the implant crown happens to be full contour zirconia, and the cuspid happens to be a lithium silicate zirconia. And again, you can see through it, which is really nice. In this lower X-ray, you see, again, full contour zirconia restorations. In the posterior teeth, you see in the maxilla lithium silicate zirconia, and in the mandible, you see lithium disilicates restoring those particular teeth. So what do I want you to get from all of this? Well, I want you to understand there are different materials. When you talk to your lab and when you get the lab to make something for you, you need to be specific in what kind of crown you want them to make. The technologies to make these crowns is not that complex. Zirconia is a little bit more complex than the others, but I know that you have facilities to make these restorations in Uganda. I'm always happy to discuss these kind of materials at any time, and you can contact me by email. I know they are going to be taking questions, so I'm happy to answer those questions as well. And with that being said, I really want to thank you for being with us today. It's going to be a long day, but it's going to be a wonderful day full of education, full of a lot of wonderful lectures by specialists and people who really care about what's going on. This picture we took on one of our trips to Uganda, and it really is a way of us thanking you for letting us work with you in your beautiful country. We look forward to being back there very, very soon. And with that being said, I thank you, and I hope everyone has a wonderful, wonderful day.